share with you my experience on OCTA angiography in glaucoma. As we use OCTA angiography since quite 2 years now, and we have an experience with a system in this domain, we can know that concerning the optic nerve head, we can have an impact with imaging on 3 different points. We can have an impact on laminar growth analysis. We can analyze the vascularization inside the disc. We have seen something new in this part. And we have discovered, as we have seen on many slides, this peri-optic disc vascularization on a very superficial layer. And so all these 3 parts have to be explored and have to be studied for also, all the patients in the future. Probably we don't have all the responses, but you will see how it could be interesting to go in this part of the imaging. Concerning the laminar clubosa, due to the high resolution of acquisition of OCTA angiography, we have increased to the unfast image, and we have increased, of course, the detection of vessels, but you can see how the system can show you the laminar clubosa when you choose a good resolution and a good focus. You can see when we zoom on the laminar clubosa, how we can compare with an electronic microscopy, and we can go with different settings. We can observe laminar clubosa in different depth, and you can see in this. You can see with the setting, you go deeper and go deeper, and we can observe in case of glaucoma, because we have correlated the change we can observe with OCTA angiography and the observation of the laminar clubosa, and we can detect that we have few variation of the diameter of the pores, and the pores of the laminar clubosa can be stretched, like you can see there, or can be enlarged. Another example of stretched pores, and you can see when we invert the images, you can see how the pores can be enlarged. And so this is a real domain of studies, of next studies, to follow up patients, and especially glaucoma patients, in order to observe this kind of situation. And so we can observe, in case of enlarged pores, we can observe that the vessels, you can see the vessels surrounding the pores. And so we probably have a direct relationship between the nerve fibers passing through the pores of the laminar clubosa and these little vessels nourishing probably these fibers. So probably that will be a fascinating domain to go on this observation of laminar clubosa. But point number 2 on OCTA angiography, it's vascularization. And so as we have focused this OCTA optoview on the optic nerve head, we have observed that it's possible to see the different segmentation, to obtain different segmentation in order to observe what happens in this part of the hand of the excavation of the background. And so you will see different slides on the same eye, on the same patient, just by changing segmentation. You have seen this morning how segmentation is a very critical point, and you will see and analyze with the different slides the same patient. When you choose this segmentation, only focus, just look inside the disc, this part of the presentation. If you can see this, all the image is black. It means that in this segmentation, as seen in the vitreous, you have no vessel. Okay? You agree with this? If we go deeper, we can make segmentation just in a superficial way of the disc, and you can see these big vessels in this superficial way. If we go deeper, you can observe small vessels, and you can see all these vessels. And so now we know that we have many vessels nourishing the fibers in this. If we go deeper, we can observe now the beginning of the lamina clubosa pores and all these vessels. So it's a mixed. If we go deeper, we can go the lamina clubosa pores, and if we go deeper, we go in the optic nerve. We are in the optic nerve, we have no fluid, and you can see an en-face image, you can see the fibers. And so we have now a new tool to observe this. And penetration of OCTA angiography, due to the acquisition system and due to the treatment of signal, is now a very powerful system to observe this part of the globe. When we have compared patients referred to a center for glaucoma checkup and this kind of vascularization, just regarding the vascularization inside the disc, you can observe this kind of vascularization and a default of the reduction of vascularization there in this moderate glaucoma. When we are in front of very advanced glaucoma, you can choose any kind of segmentation. You have no vessels inside the disc. And so you can observe how it's important to manage and to follow up this kind of vascularization inside the disc. As you have seen on these images, sorry, I can go back. As you can see on these images, segmentation is not very easy to obtain, and the same part with the same segmentation on the periphery of the disc and inside the disc. So the tool we can use today, we have to choose. We make examination inside the disc or we make examination outside the disc. Probably in the future we have segmentation follow the contour of the optic nerve, but at this time it's not so easy to obtain the right segmentation. So we are in front of vascular network inside the disc, but not at the same plane that the vascular network around the disc. But we have one situation when these both networks are on the same plane, is when we have drusen. When you have drusen on the optic nerve, you can observe this typical situation, and you can understand that we have a continuous network around the disc and inside the disc. We don't have a network inside and outside, it's the same thing. And so when you see the excavation of the optic nerve, we probably understand that the vessels have some damage just for mechanical points, just on the border of the disc. And so we try to follow what are the feeding vessels of this, and it's very difficult. We don't know, we don't see very clearly where is the nourishing vessel for this little network. It doesn't seem to be directly connected with big vessels of the optic nerve. And so probably we have a peripheral connection to give fluid on this network. Third part of the study concerning glaucoma is the analysis of this network around the disc. It was the first observation with OCTA angiography because of this very low flow in these vessels and because of their very small diameters. Probably fluorescein angiography have not shown these vessels, and when we practice fluorescein angiography, we contact all the different layers of the retina, and so you can have a level of gray in the images of fluorescein angiography, but we are not able to detect this little vascular layer like we can see there. And you can see with a correct segmentation just on the RNFL layers, you can see all this continuous network around the disc. And so it was a real discovery when we have seen this kind of images. At the first time, OCTA angiography was directly focused for age macular degeneration. And so when we decided to go to the optic nerve, we have discovered this part of the anatomy we were not knowing very well. And if we make the same thing like previous slides, and just concerning the focalization of the segmentation on the periphery of the optic nerve, you can see that we have no fluid where in the vitreous. So we can go deeper with the segmentation. You can see that we are just on the limiting membrane, and you can just see the beginning of the structures on the surface of the retina. And if we go deeper, you can see just the focus positioning of the segmentation to observe this radial peripapillary network. If we go deeper, you can have the segmentation on the inner vascular plexus, and we can go deeper, and you can see the focus on the deep vascular plexus there. And we can go deeper, you can see less and less vessels because we are just on the visual cell level. And if we go on the pigment epithelium, you can see other things, but very, very poor vascularization. So you can understand that all these images are depending of the acquisition first to be on the right place, to be perpendicular to the structure we want to observe, and all this analysis, when we have the images, depends on the segmentation. And you have seen this morning this kind of images proposed by Spade, and the very new thing with OCTA angiography was to show this layer of vessels completely mixed with the nerve, the fibrous nerves. And we have the other plexus, superficial, and so we are thinking that we have 3 levels of plexus, vascular plexus in the retina around the disc. And so, as I've said to you this morning, we practice a special way of making ophthalmology because we have many patients all the patients are referred by doctors, by an ophthalmology doctors. And so when patients are referred at our centers, frequently it's for a checkup for glaucoma. And so our conventional observation was for glaucoma we practice visual field, RNA film, and GCC. And so making this, we have just had another option, which was the OCTA angiography around the disc. And so we have been surprised to see some images you will discover, and you can have a different situation. One, we have a patient with no doubt of glaucoma history, with RNFL normal, GCC normal, no problem with the visual field. We can observe this very dense network, and you can see how these little vessels are just together. We have had a few interrogations at the beginning with this. You can observe RNFL default in this part, and you can observe an enlargement of this plexus. For other patients, you can observe this. You can real default on the RNFL, the default on visual field, and no vascular plexus around the disc exactly at the same location. At the opposite way, you can observe that we have still this network around the disc where we have no thinning of the RNFL. And when we go to a very advanced glaucoma grade, you can observe that we have no vascularization around the disc. So, when we have seen these first patients, it was impressive. So we have decided to conduct a study, and we decided to follow 150 consecutive patients referred to our center. We have excluded patients with treatment, with surgery, and we have just studied 33 patients where we have visual field, OCTA with NFL and GCC, and OCTA angiography. We have divided these patients in 3 groups based on the conventional imaging references. And when we have no alteration of these 3 points, we consider that these patients have no glaucoma evidence. If we have few alteration of 1, 2, or 3 of this classical observation, we classify these patients in group 2 with moderate glaucoma. And when we have free alteration of this free and very dense thinning of the RNFL, GCC, and visual field, we have classified this patient in advanced glaucoma, just based on the ophthalmic imaging. No history with treatment, no history with the follow-up of the patient, just see the objective references of images and select the patients into these three groups. And in these three groups, we have a report to the OCTA angiography and look at the vascular network around the disc and say, well, we have no sign of reduction of this vascularization. So for us, it's normal vascularization. We have a localized reduction, it's moderate reduction of vascularization, and we have a very extended reduction. Making this, we have the different groups, you can see, normal with no reduction, localized, and extended. You can understand how we have selected patients. And making this, we have these results. So we have your three groups based on the conventional glaucoma approach. Group 1, 31 patients with no glaucoma. Group 2, 74 patients. And group 3, 19 patients. And we select in each group and regard with the OCTA angiography how was the distribution of this vascularization. And so you can see that when we have no glaucoma sign, we have mainly patients with no reduction of vascularization. When we regard the group of moderate glaucoma with conventional references, we have mainly moderate reduction. And the same thing for the group 3. If we regard, we have mainly large alteration of the vascularization. So in our mind, we have no doubt. We have a relationship between these different criteria and the vascularization around the disc. Now we are going to go on with many other studies. The problem was in this study we have just a morphological reference and a subjective analysis of this different zone of non-vascularization around the disc. And so as we are working with Yalija and David Wang, they have developed in their labs and with OptoView few index for observing the quantitative part of this alteration. So they have first of all published one study concerning this observation inside the disc, and they have described the flow index inside of this red disc in order to quantify the fluid inside the disc. The problem making this is when you have a flow index inside the disc, you have a flow index of the very thin vessels and the big vessels. And as you know, big vessels are very different from a patient to another and from an eye to another eye. So we have not really standardized observation of something that we can correlate with other alteration. So we decided to go outside the disc, and we have used this kind of tool in order to observe this index, this flow density around the disc, and we have used this one. This one was dedicated to the macula, and we decided to go around the disc, and we can get percentages of flow density around the disc. But as you can see, it's just localized in this part and not on the. You have to take 4 or 6 analysis. It's not so comfortable. So with OptoView and David Wang, they decided to modify the analysis in order to extract the information around inside the disc. So we don't have to take into account. We can get measurement. You can see this index, but to get an analysis of the vascular of the periphery of the vascularization around the disc, we can select different quadrants in this double disc, and we can analyze these indexes in this ring. And making this, we can have data on nasal, nasal inferior, inferior temporal, supratemporal, supranasal, and temporal. And you have the whole fast index. But the rule on fast index take in account this one. So we prefer to make in account of these different values around the disk. And so now we probably have an objective analysis of this part of the vascularization. And another step of the software was to use this grid. It was the same thing, it was this grid based on the macular analysis. But if we center the disk in the center of the square, we can have some analysis of these indexes in these different quadrants. And so in this stage of the software, we are able to analyze the objective alteration of the vascularization. But this takes into account that we have practiced the acquisition at the right position, we have selected the good segmentation, and so you will have confidence with the results if every point of this acquisition and analysis will be okay. So now AngioView report can show you these different data with these indexes in this disk, and you have the responses there, and with this kind of map, and you have the results there. But in my mind, as we are convinced that the problem is not the flow, it's a reduction of flow. And so, as the problem with glaucoma is we have no flow in few vessels, it seems to be more positive to observe the non-perfusion area. And so, as this tool has been described to observe the avascular zone in the macula, we can use this tool around the disc. And so, at this time, we can select and we can detect all these areas with a reduction of flow. This is a software proposed by OptoView, and David Wang and Yalija proposed another system to detect. And so as they are working all together, they try to improve the efficacy of this. But if you want this different kind of situation, you can see this. And now we have a very efficient tool with probably a quantitative approach to observe this kind of situation with moderate glaucoma and this kind of situation with very advanced glaucoma. So, as you can see, we have many work to do, and if we go to OCTA angiography, it's a very efficient tool for edge macular degeneration. But in terms of glaucoma, we have all studies to perform. We don't know how it works really. We don't know what is the relationship between this reduction of vascularization and the glaucoma. Do we have, first of all, an alteration of the fibers, or do we have, first of all, an alteration of the vascularization? What is the relationship between both? And the other question we can ask is, when we put a drug, when we decide to practice a treatment for these patients, do we have a treatment that protects the vessels around the disc, or do we have treatment that destroys the vascularization around the disc? We don't know. And so now we're screening all our patients in order to observe the evolution of this vascularization with treatment, without treatment, what kind of treatment. And so that will be very, very interesting in the next future. But at this time, you have understood that laminate fibrosa can be observed. So we have probably a few interesting works to do on this part. We have to observe the vascularization inside the disc, but with the limitation of the big vessels, making disturbances of the fluid and making difficulties to obtain a very quantitative approach. And so, at this time, the main goal is to observe around the disc this vascularization and make the correlation with the glaucoma. So, we are at this stage where we can observe the non-perfusion area, and this is my favorite criteria, because we want to detect lowering of the vascularization, so probably that will be there, but probably that will be a combined analysis with non-perfusion area and flow index or vessel density. You know, that's this kind of approach can be probably very powerful if we keep in mind that we have to just point that the analysis can be done by any technicians, by any engineers, but the acquisition at the time the patient is in front of you, it's the main key of the results and the main key for limiting the response and the false analysis.